Morning everybody, welcome to another Mancoll Minute. Hope you had a great week. Things are heating up outside and we're certainly busy in here as the world opens up again. So in the, sort of in the line of answering questions that have been coming through social media, one came through this week which I think is a great question. What happens if I lose a lot of weight, 30, 40 pounds, and I've had a breast augmentation? And I'll take that to kind of a sister question, which would be, what happens when I get pregnant? Okay. As a rule, I'll tell you, there's no one thing that can happen. A lot depends when you're losing weight, where you lose weight. Now, some people will tell me, because I ask almost everybody who comes in for body contouring, how's your body gain and lose weight? And they'll say, gosh, the first place I lose my weight is always my breast, or it's always my stomach, or it's always my butt. So think about how you gain and lose weight. So if you're one that you always lose weight in your breast, and you have implants in, my guess what's going to happen is the implant is going to get stuck. It's kind of in its scar capsule, wherever it is, your breast, which is sitting on top of it, and then you take the stuffing out of that breast, it's going to probably fall off of that implant, and you're going to have almost like two lumps. You have the mound of the implant, and then you have the breast itself, which is probably now droopy or ptotic in the medical term, sitting below. And now they'll be kind of out of sync with each other. Now there's the patients who say, I never changed my breast, and chances are you won't see much of a change with your breast. So you're going to fall somewhere in one of those two camps, or you're going to be somewhere in between. When I have patients come in, and I frequently do folks who've had massive weight loss, and by definition we think of that about 100 pounds or more, most people's breasts have really shrunken up a lot. I mean, the stuffing's gone. It's a loose bag of skin with a little bit of glandular or breast tissue in it, and it takes a big hit in many cases. When you contrast that to the pregnancy, if you've had implants in, your breasts get bigger during pregnancy with all the hormone changes and everything that a breast is getting geared up to do to support the baby. And then when you stop breastfeeding and it all goes down, just like I mentioned, the implant tends to be stuck in its pocket, in its capsule. The breast enlarges over it, and then as it all shrinks, the skin tends to fall off. So you get this look where it kind of becomes a little bump of the implant and then the breast itself underneath. And you can call that a Snoopy dog look, is one of the terms I've heard people refer to. Some people call that a double bubble at times, depending on how it looks. Regardless, it's very correctable. It may be we have to do some skin tightening. It might be all you have to simply do is go in and release that scar, that capsule I've referred to, and let the implant just drop a little bit to get back in sync. And then there's a lot of folks who just simply want it all tightened back up again. Maybe they want to go a little smaller, maybe they want to go a little bigger with their implants. So it really kind of is going to come back to, what are your goals? How do you want your breast to be when it's all said and done? But if I summarize it all up, I'd say, if you lose 30, 40 pounds and you're prone to losing a lot of that in your chest, you're going to probably see a big impact on how your breasts are affected. If you're one where that's not really where your body focuses its initial weight loss, probably be just fine. Hopefully that answered the question. If you have any concerns or want to elaborate or kind of follow up on that some more, just give me a call. Have a wonderful weekend. We'll talk to you next week.